Hey folks, let's have a look at this neonatal resuscitation scenario. So this is a baby that delivered at home before paramedics arrived, and their first objective is to dry and warm the baby. So they're doing that right now. Let's have another look. So what he was told here by his instructor was to take 30 seconds to dry and warm the baby. And that means a couple of things. It means taking the blanket or towel that you've got and doing that, and then focusing on the head, because that's the most important part. That's where babies lose the most heat. And then once you've dried the baby, you've got to pull that cold, wet sheet out of there or towel out of there and wrap the baby in another warm sheet. So at this point, after 30 seconds, he's taking an apical heart rate to see if it's above 100, and if it's not, then he'll have to take another step.
You get 5 beats in 6 seconds.
So that's 5 beats in 6 seconds. So 5 multiplied by 10 means the heart rate is 50 beats per minute.
BVM with O2 or no O2 every 3 seconds. 1 and 2.
So let's just go back a little bit here and see what happened. So he determined that the heart rate was less than 100, which means that this baby needs bag valve mask ventilation, and that this is going to be done without oxygen. So if we look at what's happening here, we've got 1 medic, 2 medic standing here, and this is where it's important to anticipate what's needed next. So while this first medic is auscultating the apical rate and determining whether this child needs bag valve mask ventilation, these other two should be anticipating that and getting the oxygen, getting the PPV, getting the suction, getting additional blankets or towels, and basically preparing for the next step. So let's carry on here.
You get 5 beats in 6 seconds.
Okay, BVM with O2 or no O2 every 3 seconds. 1 and 2. 1 and 2. Trying to warm the baby.
Again, here, when it comes to warming, the focus should really be on the head. That's where a newborn loses the most heat, and so the head should be wrapped with a hat or a blanket or something.
Checking the extremities.
Once again, this other student could be getting the oxygen ready. We'll talk about the airway management in just a second here.
There's 30?
30 seconds?
Yeah.
You had 60 seconds. Did I hear the heart rate improving?
3 beats.
All right, so we've just been told that the heart rate is 3 beats in 6 seconds, and that means the heart rate is actually 30 per minute, which is certainly not good. And at this point, if you recall from your medical directive, what we need to do now, since we've already done 30 seconds of positive pressure ventilation, is we need to go to chest compressions.
3 beats in 6 seconds, so 30, so we're going to only got 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
So you'll notice now that this paramedic hooked up the BVM to oxygen, which is appropriate. So once we start chest compressions, we hook up to oxygen.
One, two, and three. 1, 2, and 3. 1,
Now you'll also notice
1, 2, 3.
that the thumbs are side by side. The compressions are good, but it should be thumb over thumb.
1 and 2 and 3.
30 seconds.
1 and 2 and 3. 1 and 2 and 3. Recess. 6 seconds.
Now this is good that the student is auscultating the apical rate. You can palpate the brachial artery, but it's a little bit difficult sometimes to palpate that brachial artery. Much easier to just auscultate over the chest and do it that way.
4 beats.
40, so we're going to continue. 1 and 2 and 3. 1 and 2 and 3.
The only other thing I want to bring to your attention here is the airway. So newborns, as you know, have a large occiput, and we need to get them into a sniffing position. Because they've got a large occiput, the neck is already flexed. We just need to extend the hand. So right now, the way the head is positioned, the airway goes from here to about here. It's almost a 90-degree angle. So what we need to do is tilt that head back just a little bit so the airway is a little bit more like this, and we're more likely to get air into the chest. Now the other thing about positive pressure ventilation with a newborn, or an infant for that matter, or even a child, is we want to ventilate just enough to see the chest rise, and so otherwise his ventilations are excellent.
1 and 2 and 3. 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 1 and 2 and 3.
You'll also notice that in the newborn the compression to ventilation ratio is 3 compressions to 1 ventilation.
1 and 2 and 3. 1 and 2 and 3. 1 and 2 and 3. 1 and 2 and 3.
30 seconds.
1 and 2 and 3.
So we continue to ventilate the infant at this point while the other student is auscultating the apical rate.
90.
90. Okay, so we're going to keep ventilating, trying to warm this thing.
Good, so that's 9 beats in 6 seconds, and we multiply that by 10. That means the heart rate is 90 beats per minute, which is not fantastic, but we can stop chest compressions and continue positive pressure ventilation until we get the heart rate above 100 beats per minute. Now at this point, the paramedics can probably discontinue the oxygen and just give bag valve mask ventilation with atmospheric oxygen.
Baby, we'll disconnect from oxygen. Yep.
Good. So the other thing they need to be doing right now is preparing for transport, and once they get into the ambulance they want to make sure that it's nice and warm. So overall these guys did really well. Just some fine-tuning points, and everything happens very quickly in the neonatal resuscitation. So you've got 30 seconds to dry and warm the baby, and at the end of 30 seconds we auscultate the chest to see where the heart rate is. If it's below 100, then we provide positive pressure ventilation. Even if it's below 60, we start with 30 seconds of PPV, then we reassess the apical rate, and if it's below 60 despite PPV, then we go to chest compressions, and at that point we hook up the BVM to oxygen, and then we continue to reassess heart sounds roughly every 30 seconds. But very quickly we want to think about transporting that baby. Good job, guys.